Most people who are thinking about having surgery have tried some non-surgical things first. So if they have something like a tendinitis or arthritis, they've tried over-the-counter medicines, Tylenol, Advil, etc. They've tried creams and rubs and things you just find on the shelf at Walmart or the drugstore. So when the surgeon suggests maybe the next step is surgery, one of your next questions should be, well, here are the things I've tried. Are there any other things that we need to try? So those things could be cortisone shots or therapy, some things that maybe the surgeon might know about that you haven't thought of. So just make sure you've tried all the non-surgical things you want to try before you commit to a surgery. Have you considered what will happen if you don't have a surgery? Sometimes there are almost no consequences to not having a surgery. Like if you have arthritis, just living with the arthritis for a little while longer is not going to change your life that much. You may have pain for a little while longer, but there won't be any permanent consequences from that. Whereas if you have a broken bone and it's sticking out of your arm and you wait to get surgery, obviously that could have potentially life-threatening complications or arm-threatening complications. So make sure you've thought about the consequences or the result if you don't have the surgery. Be sure to ask those questions. No one likes to think about the complications of surgery, but every surgery has potential complications. They're probably really rare, statistically very rare, but the list might be long. Infection, damage to nerves or tendons or arteries, the need for future surgery, the cyst that is getting taken out could grow back, the tendon that's getting fixed, it could rupture, there could be anesthesia complications. The pain that you're having might not completely go away. These are technically complications that could happen with any surgery. So you need to understand, number one, what the possible complications might be, and then what the likelihood of those complications might be. So be sure to ask about that. Another important question is, how close to normal will I be after this surgery? A lot of people think that if they have the surgery, it'll turn their finger, their wrist, their elbow into a normal joint, a normal arm, a normal hand. This is almost never the case. So, a good question to ask is, what percentage of normal will I be? Will I have 90% flexion of the fingers? Will I have 100% range of motion of the wrist? Will the clicking or catching or pain stop completely, or will there be some leftover pain? Those kinds of questions. What percentage of normal will you be after the surgery? Be sure to ask questions about the recovery. What's the recovery time? Is it 4 days? Is it 2 months? How frustrating is the recovery? Are you going to be prevented from driving, prevented from working your normal job, or at least have restrictions during the job? Ask questions about specific activities that you're curious about. When can I work? When can I drive after the surgery? Make sure you have a good picture in your mind about how that recovery process will go. Sometimes it's not predictable, but for routine things, for most surgeons, they're going to be able to tell you how that recovery typically goes for most people. And again, these are averages. So yours may go a little slower, or go a little faster, a little easier, a little harder, but be sure to ask about recovery time and recovery process. Be sure to like this video and hit the subscribe button, and I'll see you on the next one.